Hello, and welcome to Geeky Nigeria's exclusive interview series, where we delve into the minds of innovators, thought leaders, and change makers shaping the future of technology, education, and lifestyle. My name is Chemaka Uche, and I will be your host on the show today. Today, we are honored to host Dr. Maimunat Alex-Adeomi. I don't know if I pronounced that correctly. A renowned primary care physician, global health expert, and the director of global training and implementation at the American Academy of Pediatrics. She has over 16 years of experience in strategic planning, program management, and health system strengthening. We're going to have an insightful conversation today, and Dr. Alex Adeomi will be sharing her expertise on global health perspectives, health system strengthening, service delivery, and education. She will not just be doing that, she would also give us a rundown into her personal life, her journey, her lessons, and then just lessons that we can also learn from her. So you're welcome to the show, Dr. Maimunat. It's nice to have you join us.
Thank you so much for having me, Chiamaka. It's a pleasure to be on here today.
Thank you so much. So I know that I've said so much about you already, but I would also like you to just introduce yourself.
Like you said, you've already given a bio about me, but I'll just add and say my name is Maimunat Alex-Adeomi. As you can tell, I'm Nigerian. I was born in Borno State, the north of Nigeria. I schooled in, I am from the Middle Belt region. I schooled in what you would say call maybe the north or southwest at the University of Ilorin before I proceeded to pursue my master's. I did my youth service in Ondo State. So I call myself a true Nigerian. I don't speak Igbo, but I speak Hausa and Yoruba and Pidgin, of course. So I think that makes me a bona fide Nigerian to the core. You've talked about my background and education. I'm a primary care physician as well as a global health expert. And my journey into global health really began during youth service, where I had been called to help deliver retained placenta. So basically, retained placenta is when after a woman gives birth, the placenta doesn't come out after 30 minutes. And you would have to either manually remove it or hopefully you don't have to surgically remove it. And I was called to do that without electricity, without surgical gloves, without a blood bank, without any means of transportation. So for me, I figured I was not going to just sit there and wait to practice medicine on that individual level, but really focus on health at the population and system level. So I then went to pursue a master's. I did an MBA, actually, which was a combined master's, MBA in healthcare management and public health. And there began my journey that has been quite interesting into where I am today, where I've done a couple of fellowships, did certification programs in global health, worked in Ghana, did further training and engagement, and now I find myself working out of, I currently have established my own entity, and I'm working to continue to strengthen health systems globally, not just anything that impacts Nigeria, but globally, because for me, like I said again, wanting to influence healthcare upstream, not just at a clinical level or at an individual level. So that summarizes my professional and somewhat personal journey to date.
Wow. You've equally answered another question that was in my mind because I wanted to ask, I know that people who go into your sector would usually have something from their childhood, probably inspiring them to pursue such careers and delve into that kind of journey. So in your case, it's not something from your childhood. I would have said, knowing that you grew up in the North, it's enough inspiration to also go into healthcare. So, but knowing that it's something that happened during NYSCs, pleasing to hear. Okay, so I would also like to know what inspires your work? Why do you do?
That's a great question, and I think it's an important question for anyone to be asking at any point in time is know your why, know your North Star. So for me, what inspires my work, especially the work that I do today, and like I said, there's a very interesting journey, is that need for wanting to do more and wanting to live a life of impact. It wasn't enough that I would sit and they bring a patient to me, and this is real life stories and we don't have anti-snake vaccine or the medication, and the patient dies because of complications of snake bite on your table and there's nothing you can do. Or they bring a patient into the emergency room, and because you don't have access to blood, they don't have money to buy the essentials, and you just watch them either bleed to death or die with your hands tied. So for me, it wasn't enough. I couldn't sit and just say, well, it's the system. I can't influence the system. I've always believed that there's something we can do. And that's why I began this journey or this pursuit of wanting to influence healthcare more at a system level and upstream, and helping to address what we call some of the social determinants of health. That health is influenced not just by going to a facility to receive care, but do you even have the education, and are you literate enough to understand that you have a health issue, or can you make, or in the case of women, do you have the agency to make a decision regarding your own health? Do you have the means? Do you have a facility within driving distance to you? Do you even have transportation to get to the health? Are you healthy enough where, as a child, you're nourished enough to have, enough adequate cognitive development? So all of those things are the myriad of factors that for me was really intriguing, that I wanted to influence healthcare at a broader level. Something else that drives my work is just this passion for equity and justice, that it's not fair, it's not right, that things are the way they are, and that there is a need for me to do something. So a lot of what I do now is helping influence programs, initiatives that strengthen health systems in various countries, whether it's to improve maternal newborn health or to improve primary care or to support the supply of oxygen at a facility because they don't have access to that. I do a myriad of things, really touches on how to make sure that people have access to health and there are no barriers as much as possible.
Actually, so I would also like to know, like, looking back on your journey, are there any personal challenge that you have experienced in your career, and then how were you able to overcome it?
That's a great question, challenge. For I keep referencing very interesting journey. So I would say the major challenge that resulted from that is I didn't really have a template or mentors who had gone ahead of me and who had done what I was doing, because it almost felt like I was charting this path. I was following this very unconventional path. All of my mates, or the things we said we wanted to, I was still speaking with one of my friends from way back, and we talked about how I landed here. And I said, then when you finish medical school in Nigeria, you're supposed to do residency. I was already writing my exams. In school, I said I wanted to do pediatrics, but when I finished my house job, I said internal medicine. So anyways, back to your question is, so for me, there really weren't any role models locally, for me at least, within Nigeria or my immediate environment, that were just really looking at, okay, health at a holistic level that I had access to. They probably were there, but it wasn't discussed. Even at the medical school level then, just talking about health, that yes, you can be a physician, but there's so much more you could do. You can try to influence health at the system level. You could be a researcher, you could be a scientist. So there really weren't any templates for me to follow. So I did struggle, and I won't say the struggles or the challenges are over, but how I've been able to overcome them is seizing opportunities. So first of all, I went to do a master's in Scotland for a program that was a unique program. It wasn't common then to do a dual MD, I said MD, MBA, MPH type. So I took a chance to go study in that program, and that opened also doors and opportunities for me. I got an opportunity to go work in Ghana because I got married and moved to Ghana there. I went to work in the very core north of Ghana with a non-profit organization. really delving in health at the community level. So I took on risks and challenges. Whilst I was there, I got the opportunity to go do a global health core fellowship in the US. To date, I still don't remember applying, but maybe it was in that pursuit of wanting to know more, wanting to just understand how to continue to improve on myself as I was charting this new path. And that also opened, and in fact, that was when I first heard the term global health. I didn't even know what I was trying to do then. I just knew I wanted to influence health at a population level, which wasn't necessarily public health. And the only route then was public health. That's when I got introduced to the concept of global health. I read the book by the late Dr. Paul Farmer, who is considered one of the pioneers of global health, and it's called Mountains Beyond Mountains. And I thought, well, this is what I want to do. This is the kind of life I want to live. This is how I want to show up as a physician. Yes, treating patients, but really influencing health beyond that. And that again continued this journey. I went back to Ghana, worked in another organization, then moved to the US. So it has really been a lot of learning and growing and building and seizing opportunities to chart that path. That's why one of the things I am really committed and passionate about is mentorship. Mentoring people that if you have a passion, you have a North Star, find people that have done that. And if you don't find, chart your path, but still find a support system. And that is really important. So I'm grateful for all of the mentors and the support that I've received along the way, and the privileges that I've also had just to continue to expand my knowledge and expertise.
Oh, thank you so much. I was just about to ask you the role that mentors have played. So it's important to know that you more or less started this journey on your own. But I'm still going to ask a question in that line, knowing that this was like a fresh path for you with no one in particular charting this course that you could follow. I'd like to know, are there people that you're currently mentoring or people that you're playing mentoring roles for? Because I know that there are so many people that would want to also toward the same path that you've chosen. So are there people that you're also mentoring and helping to do the same kind of things that you're doing?
Absolutely. So now part of giving back is I participate in a lot of mentorship, either with groups or institutions. So for my alma mater, where I did my master's, University of Aberdeen, I'm part of a mentorship program that they run where we get assigned mentors. And it's been a great experience where I've got to mentor people from Norway to Sierra Leone to Ghana. So for me, that has also been, I know mentorship is really a two-way thing, where as a mentor, you also gain from the experience. I mentor a lot of people who reach out to me personally. One thing that is obvious is at some point, there's only so much you can do in terms of one-to-one mentorship. So I engage on LinkedIn a lot because for me, I've had access to mentors directly or indirectly from learning about their work, the content they put out there on social media. So I try to do that to hopefully inspire people. I myself and one of my very good friends, we started a platform. It's called Public Health in Real Life. And what we do is we try to do programs where, we call our motto is celebrating unsung heroes on the field, highlighting key public health issues, and then inspiring the next generation. So now I do that at scale by putting content out there, having people connect to me on LinkedIn and various social media handles. And everywhere I find myself, whether it is on a job or part of a group, I just open myself to mentorship as much as I physically am able to, just with time constraints.
Okay, that's beautiful. Okay. I know that you've worked in over 40 countries. So I would like to ask, mostly countries that are in challenging conditions and situations. I would just like you to share a moment, probably something that you experienced working with these countries, something that probably left a lasting impact on you and changed your mindset towards certain things. Just share that moment with us.
That would be a tough question to answer because a lot of my work Doesn't mean I've visited all of the countries where I influence, but I've visited a lot of countries because you can have projects and have managers that get to be the field staff or the boots on the ground. But I've had a lot of rich experiences from being in South America to Europe to Asia, doing all this work in different places, Middle East, of course, Sub-Saharan Africa. But I'll say maybe the most recent field experience, as we call it, that I had was because everything else you get to understand the system, you see and you know your why. And coming from where I come from, the things are not strange, the challenges are not strange. But what usually makes me realize that there's still work to be done is the last time I sat in certain healthcare systems in Nigeria, and where, like I said, during NYSC was 2007. And I go to the field 2021, 2022, and I still see the same challenges. For me, I'm like, the work continues. But back to your question about maybe one experience that really sticks with me, because there are plenty, is I was on the field in Morocco for a mission. It was an educational mission because I work in health workforce training, education and training in Morocco. And usually what we'll do with the organization I worked with then, they would screen the patients before they select the patients who are eligible for surgery. And surgery is on cleft lip and palate. And I'm not sure if you know cleft lip and palate. So a child born with like just an opening on the lip and sometimes on the palate. So you've probably seen those. That's what the cleft lip and palate is. But this baby was born and had both cleft lip and palate. And the problem, if it's just the cleft lip, yes, it still limits a lot of functions, but at least they can feed. There's just that cleft that shows there. Over time, it affects speech. But if they have a cleft lip and or palate, and it's bad, there's a hole at the roof of the mouth that doesn't fuse during the embryo stage, then the child can't feed. Then the child is at risk of undernutrition and starvation and infections and all kind of stuff. And of course, who are the people who are most affected? Those who don't have access to healthcare systems or who are not knowledgeable enough about the conditions. So we had gone to the field, and during screening, I just walked to that area and I saw this mother who was holding her baby, who didn't qualify for surgery because of a cleft palate. So our team of dentists were going to try to fashion like an obturate or something to just close that place so the baby can feed. But the baby was crying and you could just see how tired the mother was. Don't forget, this is Morocco. I don't speak Arabic. My French is very minimal at best, so I couldn't even really communicate with the mother. But I just walked in there and I don't know why I walked into that specific room. And I saw her and I just said, okay, can I hold the baby? So I held the baby and I just started rocking the baby and the baby slept. And somebody now translated it and said, somebody took a picture of it. I didn't even realize I was just, again, holding this, I think probably about like between 3 to 6 months. But of course, the baby was small for age and malnourished. And the mother was, they said, the mother said, God bless you for what you are doing. You've come to help us, type of thing. And I was like, I'm not even there. The baby didn't even qualify to receive surgery, but was just there to get something to ease the condition. And what makes that story even more interesting, because I did write a post about it on LinkedIn, Facebook, I believe, was I had just received a call from home that my son was sick and that he had strep throat, and I felt helpless. But I just walked into that room where I was able to help another mother. And this was at that time where they were talking about COVID and it was spreading. Should you travel? Should you not travel? Anyways, long story short, that for me showed me the power of human connection and connectedness, and the fact that you can do and be anything. You can be a mother to many more people than you biologically birth or in your environment. And that, again, back to the social determinants of health. Sometimes you might just need to give an encouraging word or be there to support somebody to limit any barrier it is to them to access healthcare or to make a health decision. And that left a very profound impact on me, because it was beyond going there to do something for a patient or to train a provider. It was helping a mother who was in that vulnerable state. And interestingly, the baby's name is Jana, which means heaven in Arabic. And at that point, it just felt like this moment of like heaven touching earth with the baby sleeping peacefully. And that has left a very profound impact on me.
Wow, very inspiring. Thank you so much. Wow. It's just so touching to know that you're actually also helping someone else, even while you are bearing your own burden as well. This is so inspiring to hear. You know, you said a lot of things and then you touched on some of the questions I still have to ask you,
Mhm.
but I think I should ask this next. You spoke extensively about the conditions of healthcare in Nigeria, and I would like to ask, what do you see as Nigeria's greatest strength in healthcare, and what do you think needs the most attention?
Hmm. That's a very loaded question because, but I do like the fact that you're asking about what the strengths are because I think a lot of times we want to focus on the challenges and really finding solutions is like we talk about the SWOT analysis, right? Understand where your strengths and where the opportunities because that is how you'll be able to address your weaknesses and whatever threatens the system. Nigeria, I would say, is we have a robust primary healthcare system. Doesn't mean it's perfect, but it's quite robust. And that's why you can see, even during the COVID pandemic, where COVID was ravaging, other countries and other countries and continents, Africa was mostly spared, well, outside of South Africa. People have different theories. They said, okay, it's maybe genetics, it's environment and all, but it's really boiled down to the health system had become resilient because of things like Ebola and cholera outbreaks and all of that stuff. So there was this very rapid primary care system as well as disaster pandemic response and preparedness that is in place, albeit not perfect, but at least it was in place to address some of those challenges. And those things can be harnessed and leveraged. Also, Nigeria, because yes, we live in the tropics, so we have increased burdens of infectious diseases and all of that. But on the flip side is there are certain things we don't have to worry about in terms of health challenges with extreme temperatures and extreme weathers. So that just means that there are certain complex things we don't necessarily have to deal with. There's now a rise in non-communicable diseases as much. Then the health system that we operate, again, not perfect, where it's somewhat of a decentralized system, but then there's still power at like the national and the federal level, with autonomy being given at the state levels and then the local government levels. So it's not like it's fully centralized and everything is controlled, where states cannot respond individually to their own healthcare needs and their own health issues. So those things I would consider as strengths. Like I said, not perfect. Within those strengths also lie challenges. I would say the top challenges currently plaguing the system right now, not just in Nigeria, but in other countries, but I think Nigeria specific, is the issue of brain drain. Now, when you think about health systems, the World Health Organization talks about the 6 building blocks of the health systems. I'll simplify it with Dr. Paul Farmer's model, where he calls it the 4S simplified model. So the 4 S's are stuff, that's your equipment, supplies, medicines; space, that's your facilities; your staff, your healthcare systems; and then your healthcare workforce, your doctors, nurses, name it, everybody that works within your health system. And then your system, that's your referral system, your how you are structured, data, everything. So using those very 4 simple S, all of those 4 things have to be balanced in order to have a strong health system. If one is out of whack, then your system is weak. And in Nigeria, with this brain drain, where I don't even know what the stats is, but it's mind blowing, where facilities, we already had a low doctor to patient population ratio, much less than what is recommended by the World Health Organization and other health agencies. We already had a low nurse to population ratio. Now you are taking further worsening that patient, doctor patient or nurse patient ratio. So that means you are skewing the health system. So that's a major challenge within the Nigerian healthcare system. The likes of Professor Dora, pardon me, Professor Dora Akmunyili of blessed memory, had done a lot of work, and I believe there are still some gains from that to ensure quality of medicines and supplies. And yes, there was a time where it was a huge challenge for the Nigerian healthcare system. But by virtue of her work, I think there has been some sort of sanity brought into that. Doesn't mean there isn't still work to be done in terms of quality medicine supplies and just the availability of it. COVID exacerbated supply chain issues across the globe. So Nigeria still has some of that in effect. And like I said, health workers, the brain drain, you don't have enough healthcare workers, then supplies, and overall just healthcare financing. Nigeria is one of the countries where healthcare is mainly out of pocket expenses because we don't have universal health coverage or a very robust public insurance system. So most people are still spending heavily out of pocket for healthcare. And with the current economy, that means more people aren't able to afford drugs, which are increasing in prices, access to health services. So it's affecting the quality and outcomes of healthcare. Just in simple layman's terms, there are more complex issues, but I wanted to be able to highlight those top three things.
Okay, I'm going to pick one of the things you said, the brain drain issues. For those of us in Nigeria, we know that Japa is a very popular word. It's most popular in the medical sector. So I would also want to know, how do you think Nigeria can retain its medical professionals? Because the truth is, most people are going into the medical field just because they want to travel out of the country. For probably a large number of persons, the essence of studying medicine or nursing is because they want to have an opportunity to leave the country. So, what do you think Nigeria can do to retain its medical professionals and ensure the quality of healthcare?
Yeah. That's another very loaded question because there's a lot that is going to have to be done. And you touched on a very important factor, the why people are even going into healthcare now, as opposed to when us and like our teachers and professors and mentors, why they went into healthcare. And you can't really change or influence people's motivation if you don't influence the environment and also what is going to be of benefit. Because as human beings, everybody wants to know what's in it for them. That's the fact of life. Everybody is working towards their own. Even when people say, oh, somebody is altruistic, there's still something in it for the altruistic person because they are like, oh, this person is a philanthropist, very altruistic. They give all their, but there's something in it for them because they feel good when they do that. So there's always something, there's some sort of motivation for people. And it's hard to address motivation or to write a policy around it or a guideline around it. So you have to think about going back to how the society is structured and it views things. So I would address that as part of more like long-term measures. Now, for the immediate need, it's really some of the stopgap mechanisms. I know the government has issued some policies and guidelines where they are now limiting travel by either, I heard a case of there was a plane full of doctors traveling to the UK and then they didn't allow them either to board or land or something along. So they are basically blocking people leaving. But that doesn't change the motivation. That's more long term. You've heard of, either ministers of health or people talking about, well, just train more. That's the solution. Well, if you are training more and people are going into it to only leave, it's almost like a basket where you open the tap and then everything is wasting. You're not retaining anything. So I think there are two ways to look at it is you have to retain the ones that are existing and then think about the pipeline of the new ones you're training. And that's a lot more like the motivation aspect. So some of the immediate stopgap measures is just improve working conditions. There are many people who don't. I have mates who, at this stage of their lives, they don't want to move. Relocating or Japa, as you said, is not easy, especially when you are already an accomplished professional, you're a consultant, you're probably a professor. You don't want to go start from scratch somewhere. But it's just because the working conditions, the security issues, those things, the risks far outweigh the benefits. And like I said, as human beings, we're going to make decisions that are ultimately of our own benefits. So that's one thing is government has to work on security. Government has to work on the working environment. Remuneration. stop owing people salaries, whether it's doctors or anything, as much as is able. And I think, you know, a lot of times, yes, I sit here in the diaspora and I talk, but I see things. And that's why I'm usually very careful talking about this, because people are like, ah, look at you, should be you to you, Japa. But I left for various reasons, and I left. But at the same time, yes, maybe you can say I Japa, but this was even before Japa became a thing. I went in pursuit of wanting to learn more and grow more, because there wasn't, frankly, any opportunity to do that back home. All of my work now is centered on not just Nigeria, but like I said, globally. And for that, I'm grateful. I'm grateful for the opportunity. So for some people, people do that for economic reasons, for security reasons, but people are also looking for opportunities to better themselves. And sometimes the system stifles people. I know a doctor, and I'll have to mention his name, Dr. Ademola Adeyeye. Brilliant, brilliant physician. This is some, you know, when you know there are people that are like geniuses, this person is a genius. In any society or in any place, you will not want to lose that person. You would invest everything you want to make that person comfortable. And this is somebody who gave of himself. He was teaching us when we were in medical school, even as a student, and he continues to teach generations. But he penned something on LinkedIn, I think it was earlier this year, and that just shows the frustration he felt in the system. He wasn't motivated. Now he's doing wonders with the Royal College of Edinburgh, Royal College of London, studying research. He's one of the foremost oncologists in, I'm not saying in Nigeria, globally, but he was frustrated out of the system. So that's not a government thing per se, because it is people who make government in those institutions where he was trying to work. So we have to encourage people to stay by not limiting opportunities for growth and development, making sure that people are well paid, because for some people that's a motivating factor. Security, nobody wants to work at. I have a friend who was kidnapped on the way to work between Akure and Owo. She's still there, but who's to say, God forbid, if something like that happens again. So yeah, people are leaving because of those kinds of reasons. So now back to the pipeline issue we talked about, because that's more long term, is you have to think about medicine in a way that, yes, it's not just this pipeline of, okay, you train and then you go work clinically. You can still be a medical doctor and then be a physician. There are medical legal people, like just really open opportunities for people to want to contribute to the society. And that way it changes their motivation, or people really think what their North Star is. So from the pipeline, from the primary school level, from the secondary school level, you're exposing people to the work of impact, to health systems, to more broadly. You don't stifle people. And then that way, I think it's not, this is where the educational sector comes in. So it's going to be a multi-sector. Then within the community itself, when you are, I am a mother, I would want my kids to pursue paths that are profitable for them, even though I'll say I want them to live a life of impact. But at the same time, if my kid comes and is like, I want to play an instrument, my first, even though I live in, you know, in the diaspora, there are certain things I'll say is like, you don't want to be a doctor, you don't want to, because the natural thing for you is you want to know that your kids are okay and that they are pursuing economically viable routes. So you have to make all those other industries and all those other pathways meaningful, impactful, and people can pursue their purpose. So people aren't just going to medicine solely for that track, because when they now enter into it, they know that they want to be there for health. And then regardless of the challenges, as long as it's manageable challenges, they will stay and want to build the system. That's how you change motivation, at least try to influence it. That's as much as I can cover now, because there's a lot more.
Okay, thank you so much. It's been such an insightful conversation and still more to go. So since we are still talking about the Japa syndrome, like we call it here in Nigeria, I also like to know, are there any pieces of advice you would like to give to Nigeria's health policymakers? Okay, this question is in two forms. The first one is, are there any pieces of advice you'd want to give to Nigeria health policymakers on improving healthcare and ensuring that, you know, our healthcare system is at its best? And then, are there also any other pieces of advice you give to these same health policymakers on improving maternal and newborn care,
Mhm.
given your global experience?
Yeah. So the first part to it is health policy maker, and I think there is the portion of those who influence health policy directly, like the health ministers, commissioners, and all. Then there's the government overall that has the overarching responsibility for the system. So first of all, in order to reverse JAPA is at least health ministers can make sure that they are working to allow facilities have adequate supplies, equipment, infrastructure, electricity. Those can be influenced, like use funds for what they are meant to be used for, not frivolous projects. We are not saying there's an abundance of resources, but there's also waste in the system. So eliminate waste and make sure that there is efficient and effective use of the resources that are available. That would improve working conditions and that will make people stay. Working on security is the role of the national government. Without adequate security, this is not just doctors, people will continue to live in droves because nobody really wants to sacrifice their life needlessly. Doesn't mean there aren't patriots who want to sacrifice their lives. God bless those people, but people don't want to do it needlessly. So insecurity has to be improved. That's on a much larger scale. And then really tackling that issue of, I talked about efficient use of resources at like the direct health policy people, is just making sure that people have safe environments, people have access to all of the resources and the supplies they need, people get paid on time. Don't hold people's salaries for whatever reason it is during election season. That's just flat out inhumane. And then expect people to work by improving those working conditions. And then I think this is more like the facility level, really understand what people's motivations and benefits are, not stifle people's growth opportunities. This is at the facility level. Maybe it's not necessarily policy, but it's encourage learning and development, encourage mentorship, encourage sponsorship and all of that. Like give people room to thrive and grow. Do not stifle people. That I think is at that other things that can be done. And yes, government, I talked about security, but overall infrastructure, right? Electricity, roads, fuel. Fuel is multiple factors. The providers need to be able to get to work to begin with. And then when you get to work, if there is no light, they will need the generator to be able to do surgeries, to be able to operate all the machines and all that. You can't influence what, there's only so much a provider or the chief medical director of a facility can do if there's fuel scarcity. So those are things that drive health. And I'm trying to remember the second part of the question. I went down this rabbit hole talking about like health policy and all that to address Japan.
Okay, the first part is what advice you have for policymakers to ensure better quality of
Mhm.
healthcare in Nigeria, and
Oh, then the
then
maternal health
to
one, I remember.
and
Yes. Okay, I think I remember now. It's the maternal newborn child health one. It's interesting to know that Nigeria accounts for one of
yes,
the highest rates of maternal mortality specifically. And this just speaks to, we talk about maternal health being the bellwether of a health system. So your maternal health indices tend to show you what the state of your healthcare system is. And Nigeria is one of the top. I know before it was like the highest and definitely the highest in West Africa, one of the top two, but now maybe we're at least within the top five in the world. And the other countries that are in that top five? It's like South Sudan, it's like Afghanistan, places that are war-torn. That is what competes with Nigeria in terms of maternal mortality. So the advice for health policy people and all is, because, like I said, maternal health is a bellwether of the healthcare system, is look critically at the health system, because once you can improve the health system, those indices will come down. Maternal, newborn, child health. We talk about the 3 stages of delay that influence maternal deaths. The first stage is delay in seeking care. So a woman is pregnant, maybe she has complications or it's at risk, but she doesn't seek care because one, she needs to get permission from the spouse or the community, or she doesn't even realize that it's a serious condition. So she doesn't make that decision on her own to go seek care, or she doesn't have the agency to do it. Those things can be addressed with a lot of health education, literacy, encouraging education of the girl child. So you see, this is more like going further down the pipeline so that women are like, this is my body, this is something's happening. I can make the decision on family planning, or I can make the decision to go seek help. That's the seek healthcare services. That's the first stage of delay. Second stage of delay is reaching healthcare. Now, a woman is pregnant, complications, but she lives in a remote area and the closest health facilities is 50 kilometers away. No transportation, or the roads are bad. We've all seen and witnessed and experienced these things. Now, the woman decided, or the community decided, we need to access healthcare services. It's no longer a delay in seeking, but it's now in reaching. This goes back to the infrastructure, those addressing all of those social determinants of health to make sure that you put facilities. And I think a lot of projects and governments have tried to work within that where you know, understand your population and understand the needs. So make sure that there are facilities within a catchment area that feed into that and have access to the resources, so that it doesn't take a pregnant woman who goes into labor and there's an emergency hours to reach a facility. She can reach there within minutes if possible. So that's how designing a very robust primary healthcare system is important, because the majority of the mortalities are happening in the rural and peri-urban areas. Now, the last stage is in receiving care. We've had many cases of people who got to health facilities, no oxygen, no blood, no time for theater to do emergency surgery, and then the woman passes. So they made the decision to seek care. They got to the health facility, but when they got there, they didn't receive the care they needed. That also accounts for a significant portion of maternal mortality. So we have to address those things. Brain drain is what we talked about. The staff has to be there. When the staff are there, like in my case with the retained placenta, they have to have the resources. They have to have adequate supplies. There has to be a robust referral system. And those things are known. It's not like it's not known, but there has to be the political will to invest in those things, because you can go find a very highfalutin solution. If you don't address those three stages of delay, you would not influence maternal health. And that also just feeds into like newborn health, child health, and all those things, because like we said, maternal health is the bellwether of the health system.
It's a very wonderful conversation. Thank you so much for your responses. Personally, I'm learning so much. So much. Okay, I know we spoke about COVID-19 in the course of the conversation. So I would like to ask, did COVID-19 reshape the global health landscape in any way? And what lessons should we learn from it for future pandemics?
Yeah. COVID-19 definitely shaped the global health landscape, and it brought a lot of positives, opportunities, as well as challenges. So I'll start with the challenges so that at least we can go to the positives. Challenges is, we all know we couldn't get vaccines. There was this whole global supply chain. Then it exacerbated health equity issues where countries who had access to the vaccines were trying to keep vaccines for their own citizens, and then Africa and other places didn't have access to vaccines, or they got the quote unquote not the gold standard vaccines. I'm not saying any vaccine is substandard or less than the other, but we all know what happened. And then also what COVID pandemic also showed was that you have to have a very robust supply chain management system where access to oxygen. I think when Nigeria even had significant COVID cases, most of the people who passed were from lack of access to oxygen. So it went back to some of those, fundamental infrastructural things. So those are the things that COVID pandemic showed. And I think there's this sort of reckoning in terms of from like a health equity perspective where I use the term developing, but it's really high income or resource rich settings and resource limited settings, or low and middle income countries. There's just this more awareness on the equity issues. And now because of that, Africa CDC that had been birthed became stronger because Africa had to come together as a continent to say, how do we address our own health issues? How do we harness our resources and leverage our own strengths and capacities to address the African challenges? So now there is a lot of push towards local vaccine manufacturing, drug manufacturing, so that you're building capacity on the continent and then not just reliant on like donor interest. And then, of course, like we talked about, like health systems and all that. On the positive side, one thing COVID also did was all the gains that had been made in global health, like reducing maternal mortality, reducing newborn mortality, child mortality, HIV rates, because of the way the system just sort of like shut down and had to really focus, the system became overwhelmed and burdened by COVID-19, people not understanding it. There was now a regression in those gains that had been made. So there's now catch up that is being done to reach those targets. We call them the Sustainable Development Goals, which you probably heard of Millennium Development Goals. Those ones ended 2015. Now Sustainable Development Goals is 2013. We are barely 6 years to there, but we are still not there in a lot of countries. So there was these gains that we're trying to catch up on due to the impact of COVID. On the flip side, like I said, now COVID showed that you have to build your own internal and local capacity for stuff. And there are conversations where even a testing labs, genetic testing labs are being sprung up in Africa, like building that capacity. We talked about local vaccine manufacturing and drug supply, just so that we can respond to any pandemic. So that's part of shoring up pandemic preparedness and response. COVID also allowed for a lot of innovations. Before telemedicine, yes, people do telemedicine, but now it became more expedient during COVID and it has come to stay. You and I are chatting now, just the use of webinars wasn't as much of a thing. Google Meet, it had always been there. Zoom has always been there, but it really, their use proliferated with COVID, just showing that we're indeed a global world now, and we're in this digital age. So we have to leverage digital tools and technology to improve health. And we're using it for health. I worked to do a lot of virtual training programs where we leverage Zoom platforms to do trainings that would have otherwise not been thought of, where you are spending a lot of money to fly trainers to a site. If you invest in infrastructure for teleconferencing or telementoring, then you are still able to provide the knowledge without necessarily moving people and repurpose those funds to purchasing equipment and supplies. So those were part of like the gains from COVID.
Things about you as well before we end the interview. So for my last question in healthcare, I would like to know, are there like emerging trends in global health that you see that have great potential to improve health outcomes, probably in the coming days?
Yeah, there are a lot of emerging trends in global health, and it's kind of like double-edged. So some of them are to improve health outcomes, access to health, equity, but then at the same time, it also means we're having what we're calling emerging and re-emerging diseases that we have to be aware of. So I'll start with impact of climate change on health. Regardless of what side of the divide anyone is on, climate change is real and climate change is impacting health. There are more instances now of like heat strokes, of increased prematurity, and it has been traced to impacts of climate change, undernutrition that is hugely affecting child health because of climate change, droughts. You are seeing all of the things that are happening with like floods, with conflict. So there's a lot of internally displaced persons, not just in Nigeria, across the globe, where wars and all that. A lot of it is also driven by climate change. So that's something that has to be at the forefront of conversations on global health or any health conversations, that you have to address the impact of climate change on health because we are seeing it. We talked about technology, digital health. So it's an opportunity in the space where you can use and leverage technology and artificial intelligence to improve health outcomes. The flip side to it is it can also increase disparities. Because if somebody doesn't have access to basic electricity or internet, how are they going to be able to leverage technology and artificial intelligence? So the people who have, it improves outcomes. The people who don't have, it doesn't improve. So we have to work at the forefront of trying to ensure that that infrastructure that is needed to support digital health and the use of artificial intelligence is available across board. Then that is when we'll be able to benefit from the gains with digital health. Mental health. Mental health is a huge topic globally now. We're seeing increased incidence of mental health challenges. It's There's more awareness of mental health, but then at the same time, on the flip side, there really isn't a lot of you don't have a lot of like resources and infrastructure to support the mental health crisis that we are seeing. So the awareness is a good thing. The awareness of its impact on health overall, like the World Health Organization and one of my friends says, there's no health without mental health. So that importance is known, the awareness, the advocacy, that's good. But then we have to be able to address it because I think a lot of countries, including Nigeria, as far as I can tell, there is a mental health crisis, especially amongst the youth and adolescents. And that is the future of the country. That is the country that's the population that is going to be influencing the economics and leadership. If you don't address mental health challenges now, what is going to happen down the line? Um, so that part. And I think also something that also we talked about supply chains. So I think leveraging like digital health and technology and all that would really improve local manufacturing and supply. So this not just spurs the economy, but makes sure that we can address that critical part of the healthcare system.
Okay, thank you so much, Dr. Maimunat. I still have some questions for you before call it a day. One of those questions would be, so what do you think would be your long-term goals, aspirations in the field of global health?
Long-term contributions in the field of global health. For me, one of the things that
Long-term goals and aspirations.
long-term goals and aspirations. Okay, apologies. You cut off for a bit. So long-term goals and aspirations. For me, I've recently delved into leadership development because I'm realizing that a lot of challenges we have in health systems and global health stems from leadership. And not just, honestly, when you think about even the economy and all, it goes to leadership. So I benefited from a lot of leadership development, and now I'm giving back by wanting to support leadership development. So I recently completed a project with the Medical Women's Association of Nigeria in collaboration with an organization called WILAN in Women in Leadership Advancement Network, where they are working to support gender balanced leadership. And really, I think for me, that is a crucial factor in improving not just health, but the economy, development, and all that, because it has been known that women's leadership improves things. And outside of that, women make up about 50% of the population, but they are not represented in leadership positions across sectors. So we have to be able to improve that and harness the powers of, female leadership or just gender balance. I'm not pushing a feminist agenda here. I'm just pushing equity. So for me in global health, I've seen that leadership is a gap and is an area to focus on, and I'm focusing on that now. And some of my goals and aspirations is really honing on human capital development, improving leadership. Because once we can improve leadership, then we improve the political will to do what we need to do. And then you change the paradigm of leadership, where leadership is about transformational leadership. It's about servant leadership. It's about collaborative leadership. It's about thinking of people and understanding that leadership is a privilege, and that when you've been called to lead, you're actually called to serve, and that changes the way people lead. So for me, that would be one of my top goals and aspirations in this space. And continuing to improve in not just maternal newborn health, but ensuring that people have access to health, especially basic health. And that's why I'll continue to work in this health system strengthening space where people have access to health, people can make decisions on health, and there aren't catastrophic out-of-pocket expenses to accessing healthcare as much as possible.
Okay, since we're talking leadership, I would like to know, has being a Nigerian woman shaped your leadership style or perspective, or even posed any challenge to you in your present workplace?
That's a funny question, and I'll probably give you the political answer, right? So, Nigerians, we have a reputation, whether we like it or not. And it has been a good thing, and it has been something I wouldn't say is challenging. It's just been an area of growth where you have we grew up and we sort of experienced leadership and what we thought leadership was. And I had to go through a journey of unlearning a lot of what leadership truly meant. And I'm grateful for the lessons and the opportunities to learn. And this is one of those things where I had the privilege of just being part of so many programs where I learned about what true leadership means, and also just embracing how, now that I understand what true leadership means, it also aligns with my own personal values, and understanding that leadership is a privilege and a responsibility, not a right. So, how has being in Nigeria influenced that? On the good side is just that Nigerian spirit and drive to make things out of somewhere, to not fall with your face down and give up, has been really helpful. On the flip side, I've had to learn a lot of emotional intelligence. Even as a parent, just because there are certain things that we experience and it's okay, yes, it's fine, but then when you think about it critically, we live in a different day and age, and emotional intelligence trumps everything. It trumps your intelligence quotient. Yes, we talk about IQ, your intelligence, EQ, your emotional intelligence quotient, and then now we even add social. So we are really very good as Nigerians on the intelligence factor, the social factor, but I think the emotional aspect of it, maybe we didn't understand that that was equally important, if not more important. So that was something that I had to do a lot of unlearning and learning on. And I'm, like I said, grateful for the privilege. And it's still a journey, because that is a huge component of leadership. And leadership is really leadership of yourself, leadership of the people you lead, and then leadership of systems.
So for my very last question, oh no, not my very last, second to the last question. I would ask that what do you hope to be your legacy in the field of global health? What would you like to be known for in the field of global health?
Hmm. That's a question I actually have to think about critically. I think in the interest of time and to respond, I just want to be known that I tried my best, and I made an impact. Now in leadership, in influencing a generation of leaders that are committing to doing better and are committing to leading transformational change. And also that I was able to influence health, especially for underserved populations, on a truly global scale. And I'm very privileged to have the opportunity to work in all those countries that I mentioned, either directly or indirectly. And I hope to be able to do more and probably even do deeper work in those places.
Okay, that's so nice to hear. And then now to my very last question. Nigeria is 64. And so I'd like to know your message for Nigeria and Nigerians.
October 1st, Independence Day. It's amazing. We're 64 today. I think my message to Nigerians is understanding that we have been blessed with so much, and to whom much is given, much is expected. So therefore, for us to take up that mantle and that responsibility of, and I talk about leadership, leading ourselves, leading wherever our spheres of influence are, and then leading society by realizing that we are all responsible for Nigeria. We're all responsible for building it. But start from that place of understanding that we've been blessed with so much natural resources, human capital, our spirit, the Nigerian spirit. It's you see it already in how our music is shaped, our culture, our fashion, all of that. That's a blessing. And we want to be able to leverage those things that we've been blessed with to really improve ourselves as a nation. And we can do it. It's possible, but it starts from us, each and every one of us.
Thank you so much, Dr. Maimunat. Thank you so much. Such a delight having you on our interview series today. I personally learned a delivery, and then I equally learned a whole lot about why I should do things that I do. Because I know you said the whys are more important than even the actions. So thank you, thank you, thank you. It's a delight having you today. Thank you for everything that you've had to share. Thank you so much.
Thank you, Chiamaka. It was you asked a lot of great questions that really had me thinking. So I appreciate that, especially on October 1st, Nigeria's independence. And I'd also like to thank Mr. Victor John in the spirit of putting ourselves out there and leveraging social media and technology. We connected on LinkedIn, and here we are today. So thank you for that. And I look forward to, further opportunities to collaborate. Thank you. And happy independence.
Thank you so much. Thank you. All right, everyone. We've come to the end of today's interview on Vicky Nigeria. We've come to the very end. And we want to say a big thank you to everyone for joining, for connecting with us today. We have this exclusive interview series over and over where we bring in insightful persons who share their stories and just delve into technology, education, and lifestyle. So thank you so much for joining us today. Today, we were honored to host Dr. Maimunat, a renowned primary care physician and a global health on the show today. So we say very big thank you. And with this, I bring the show to an end, but not without reminding you that Geeky Nigeria is a renowned media organization, and we are known to inspire and inform. So if you're looking for reliable content on technology, lifestyle, or even education, then look no further. Just check www.geeky.com.ng for reliable content you need on healthcare, technology, education, and lifestyle. So see you next time on our exclusive series. Enjoy the rest of your day and happy independence once again.